today we'll need to go through week 4 information, and before we learning the new slides information from Blackboard, let's review what we have been studied in the past 3 weeks. I believe you all received this information from my class message in the Blackboard. And this part I adapt from the week 1, 2, 3 and revision exercise first slide. So basically in the week 1, we discussed assessments required for passing this subject, and as well as the difference between warm heat, summer heat, toxic and fire in terms of TCM, concept of Wenbing, 7 classifications, Wenbing, and very brief comparisons between the subcategory of the Wenbings, etiologies, pathologies of Wenbing, and most common pathway for Wenbing suffering, as well as the major pathological changes. And also discuss a little bit Li Qi, lurking pathogens, Western infectious disease correlate with Wenbing. Concept of Wenbing, study of the Wenbing and development of Wenbing in the history, as well as most outstanding scholars who contributed or developed some theories of Wenbing in Chinese history. So that's a week 1. And in week 2, we discussed briefly about warm heat, damp heat pathogens in regarding to Wenbing and their treatment principles for these 2 correlated pathogens in Wenbing, and also have brief compared concept regarding to difference or similarities between Shanhan and Wenbing. And we also discussed briefly or basically clearly about 4 levels in regarding the qi and blood classifications. And we reviewed 4-level differential diagnosis and Sanjiao differential diagnosis used in Wenbing differentiations, and also discussed a little bit 4 levels differential diagnosis and Sanjiao differential diagnosis and their relationship to each other, as well as correlated with some organ differential diagnosis. Had some brief case study. In week 3, we discussed or introduced some common treatment principles used in Wenbing, as well as a common treatment method, corresponding formulas, example formulas in Wenbing. Some of these will be repeated again through each category discussions in Wenbing from this week. And we also go through the common special internal pathogen discussion, contraindication, and postal care as a kind of basic introductions in Wenbing. Emphasize the importance of a tongue diagnosis and skin differential diagnosis applied in Wenbing, and common symptoms differentiations in Wenbing, as well as brief case study to help us review some common patterns, formula, and used in Wenbing. So let's have a look how much we can click back or consolidating understanding through this very basic true and false exercise. All right, it's warm-up time. You are welcome participating your mind and your specific effort into this exercise. Let's start. I turn off my nasty image. So there are 4 statements in these first slides. Thank you for your encouragement. So number 1, somebody click the choose. Fever is a main or an essential feature discussed clinically in the classic Wenbing. We all agree. Okay, the reason is because common understanding of etiologies is heat related. So fever is quite a common clinical manifestations in Wenbing. That's what we all understand it in the training. Excellent. Number 2, the 4 levels identification can be used for explaining heat pathogen related disorders in modern practice, no matter there's a fever or not. Is that true or false? Okay, now somebody clicked true, somebody clicked false. Let's have a look. Basically, we don't have much of a chances to see or to using the 4-level differential diagnosis if they're all very high temperature involved, because they all end up into go to see the GP and hospital. But why we still need to learn this kind of theories? Because they still can be used to deal with heat pathogen-related disorder, such as skin issues, or you call the allergies, autoimmune disease in modern conditions. And no matter they have fever or not, once their tongue represents as a crimson red tongue body without tongue coating, or skin rashes shows very, very bad redness and shows typical heat in the local nutritive level or blood level, may have easy bleeding, we can apply these theories into modern practice. So this is truth. This is a very important part for us to learn. Otherwise, this theories will be outdated. No point to learn that anymore. So now 1 and 2, they all choose. Any questions for number 2 or any disagreement? Okay, number 3. The concept of Wenbing has further developed from the broad concept of Shanghai in regarding to entry paths of external heat pathogens and progression post-heat pathogenic attack. True. Okay, it's true. And Shanghai is focused on basically go through the stage of Taiyang and they keep going inside from the lung systems attacked. But for the Wenbing, they focus on specific nose, mouth, and skin. So it's further developed. And also Shanghai is a bit slow progressions because the cold is dominated, and compared with Wenbing's heat dominated, very quick, fast progressions and much more speeded up and changes in the symptoms. So Shanghai, if within 1 week, 7 days, if problem cannot be resolved, usually they are not going to stay in the Taiyang divisions, either turned into the Shaoyang, Yangming, or other divisions. But for the Wenbing, within the 7 days, you can see revolutions. You can see big, great changes and even life changes as well. Number 4, there are some overlapped understandings for pathogenic transmissions or progressions in the body from both Shanghai and the Wenbing theories. True. Okay, because Wenbing is a part of the further development of Shanghai, definitely they are going to have a lot of overlap. And one part of overlap is transmission and or progressions in the bodies from both Shanghai, especially from Wei level go to Qi level, or from Taiyang division go to other division. This is a typical path. Thank you. That means first slice, all these focus are correct. Okay, any questions or any doubt for this part? Okay, if you keep silent, means you're okay. Let's have a look. Second one. In the Shanghai, to understanding the functionality of yang qi's rising and the restoration in human are very important. Okay, there are choose, there are questions. Okay, this concept maybe has not been mentioned in your Classics 1 class, but if you do realize the yang qi, focus on yang qi's weakness or strength or strongness is very important points, and you will associated with the sun rising, sunset, and the 9 times changes about the yang qi. So this is the correct. Basically, Shaoyang is trying to mimic the yang qi's rising in the morning, and the Taiyang is the yang qi's exuberant and during the noontime. And nine time is yang qi's restoration internally regarding to 3-yin division. So basically, based on the yang qi's circulating or changes within the body and in the universe associated with the systems, and this is a correct concept or correct statement. This is a very important statement as well. That's why if you're living based on traditional classic form, you'll not go for 9-time dancing in the clubs, because 9 times you are not supposed to allow the yang qi comes out of your 3-yin division. Suppose yang qi will be restored inside the 3-yin division. So during the daytime, you could be more physically active. At 9 time, you should be rest, especially after 9 p.m. Thank you, Ri. And the Shanghan is focused on the importance of yang qi because the most of pathogens are cold involved, and Wenbing is focused on how to protect body fluid because most of pathogens are heat and very easy to damage or injure body fluid, especially thinking about high temperature sweating. Of course, the body fluid very easy to be consumed. So first, number 5 here is correct. Now, how about number 6? In Wenbing, to monitor, protect the yin or body fluid during suffering heat and heat damp pathogenic attack is essential. So it's already part of the question already answered. But why during the heat damp pathogenic attack still need to monitor body fluid? Because body fluid is a kind of yin substances. Once the damp become pathogens, require consuming a lot of body fluid. With combination both damp and heat pathogens, much more easier to diminish the body fluid in the natural form. So in that way, you are naturally is going to minimize resources of body fluid. So look after body yin or body fluid during the Wenbing and clinic during Wenbing in the clinical practice is very, very essential part. It's similar like look after yang qi during the Shanghan illness discussions as well. Yes, thanks, Nicola. Thanks, Ray. That's good. And there's a question, how do we do this without adding to damp? Okay, there's some statement will tell you about these questions. We'll have a look at the next statement, following statement. Number 7, the pulse can well detect levels of the qi in the body. Therefore, the pulse diagnosis has been well focused in Shanghan while utilize 6 division identifications. So this basically tells you in the Shanghan Lun discussion, due to cold pathogenic attack, very easy affect the yang qis and rising and descending. So pulse is very good signs, help indicated up and down of the qi. So this is makes sense. So pulse differential diagnosis is very important. New practice or focus on these classics of Shanghan. Thank you. So in comparison, the tongue and the skin rashes can show physical changes in system, differential diagnosis of them, and can help well practiced clinically when dealing with Wenbing. Because the tongue and skin rashes and can combine together very well represented severity of the heat inside the system. So when you stick your tongue out in the morning, check it in front of the mirror, you will know how much of heat or damp and your body have. That tells you what kind of balance level regarding yin and yang. So this is definitely correct. Like somebody says, okay, when I eat, everything else is fine. Eating barbecued food, I'm going to have skin rashes. So this typical barbecue is directly cooked on top of a fire. So this generates heat, more dehydrations, and result skin rashes. Also did experiment last night, cooking same food. One is on top of stove with a bit of oil. The second is cooked directly on top in the oven. So basically dried cooking. So one in the oven and getting very dehydrated very quickly. So this answered in a way, same as a barbecue in general lots of more hot and dry dehydrated food. So same for this whole second slice, they're all correct. But which was more delicious? The one cooked in the oil is more delicious because they're sealed outside and very, very well, and generate very nice crispy surface for the dishes. And also inside still can maintain very good juice. The one I cooked in the oven, and because the high temperatures outside, inside, they break out, the liquid break out and makes it so messy at the end. Okay, thank you, Lucy. Now next slide. Number 9. Bitter and cold herbs can create excessive damp heat or fire, which is safe applied for fever-dominant cases in Wenbing. Be careful. We mentioned previously, no matter what causes Wenbing, we need to look after what? Look after yin. So bitter cold is what? Very cold and dry. Thank you very much, Jennifer. Thank you. So that means first half sentence is correct. Second half is incorrect. I'm sorry, I mixed together, folks. Just have a bit of fun. So this is incorrect. I put a cross here. So the first half sentence is correct. Bitter cold herbs are very effective to clear the damp heat and fire because they're very cold and dry in nature. But if it's associated with Wenbing suffering, no matter what passage causes Wenbing, you have to look after body fluid, the yin. So this is incorrect. So when you're using bitter herbs to clear the damp heat in Wenbing, you also need added yin tonifier herbs to supply the yin, added aromatic herbs to help resolve the damp. So this is answers for Lucy and the question you had previously. Thank you. Now here comes the number 10. 藿香 and 青蒿 are bitter and cold herbs. They are very useful applying for Wenbing cases who have damp heat pathogen. So same, this whole sentence, half of the sentence is correct, the other half is incorrect. So these two herbs are not just bitter cold. They are aromatic and this is warming. So most important, they are aromatic and have specific ability to disperse the vent heat to the out level. So second half sentence are correct. They are very useful applied in damp heat conditions suffering in Wenbing cases. So this whole sentence or whole statement is incorrect because the first half sentence is incorrect, second half sentence is correct. So here just remind you, these two specific herbs are very useful to apply in Wenbing damp heat patterns disorder clinically. They can vent the heat out to more superficial layer without damage body fluid, without causing severe damage for the spleen qi. They're very gentle. Thank you. Any questions? It's great. I'm very cooperative, supportive here. That's good participation. Thank you. Number 11. The Wei, Qi, Yin, and Xue disorder can be categorized as Wei and Qi disorder. So can it grouped as Wei, Qi together. Specific focus on functionality disorders or Qi conditions or Qi disease. So that means no structure changes and just Qi activity has been disturbed. Second is Yin and Xue disorders and correlated with structure, tissue, or organ injuries, or called as a blood disease. So that means divide this 4 levels into 2 categories. Are they correct? So if people suffering Wei and Qi disorder, once they're recovering, no damage for their organs and tissues. But once people suffer nutritive yin and blood disorder, once they're recovered, always left behind some scar tissues, enzyme elevated, and some organ disorders. Thank you very much. They are correct. So number 11 is correct. Here it just tells you different end of result after recovering from different level of illness within the 4 levels. So for the first 2 levels, once you're suffering Wei level disorder, Qi level disorder, once you recover, there's no organ dysfunctioning and no enzyme changes from blood test. You still looks like nothing happened. But if you're suffering nutritive yin or blood level disorder, after you recovered from that, either you left some scars for the body or some structure damage, some tissue injury, while remaining as a part of the evidence tells you you had nutritive yin or blood disorder suffering. So no matter it's Wenbing or modern disease, so same like people have modern nutritive yin disorder, psoriasis, so they always have some scar tissues there. Even clinical symptoms has been very well managed, always some pigmentation left behind, or some evidence shows there's some skin issue disorder in the past. Now, number 12, the tongue color changes are the signs of structure changes in the body. Okay, if this is an absolute statement, which is incorrect, if you say some tongue color changes could be the structure changes in the body, that'd be correct. So based on this statement, or based on this kind of construction, which is incorrect, that means all the color changes means structure changes. But once the heat in the Qi level, does the color of the tongue change a little bit? Tip and edge, yes. So only whole body's tongue color become crimson red or no tongue coating. So go to nutritive yin and blood level, and they indicate with structure changes. So when we put the words into the clinic form to describe patient's conditions, do be more precisely to describe people's tongue. So some people say, oh, the tongue is red, or tongue is purple, or tongue is a pink. And sometimes little pink red, purple red is going leading to different possible pathogens regarding their conditions. And sometimes if you say, oh, there's coating yellow, is a thin yellow, is a thick yellow, or greasy yellow, or dry yellow. So this can help us understanding more precisely about the possible pathogen and pathogenesis and severity of the conditions clinically. Now, any questions for this slide? So basically only one correct, all the rest are incorrect. Thank you, Wenli. What's the question?
Yeah, sorry, Yimei. I think I missed the question 10. So I don't understand what you said about question 10.
Question 10. Okay. All right. Question 10. 藿香 and 羌火 are very beneficial herbs used for Wenbing damp heat resolving conditions. But these 2 herbs are not typically bitter cold. They are aromatic. 青蒿 and 藿香. Yeah. Does that answer your question? Or has that answered your question yet?
Yeah, yes, got it.
Yeah, okay. Thank you very much. Okay, it's great if we are not very clearly or have doubt about some informations, and do raise your hands or ask questions. It's great. Thank you very much. We can help everybody to clarify some issues. Now, number 13. No tongue coat or geographic tongue coat indicates serious injuries of body's fluid. So this basic, we all agree this is correct. So they could be current, could be the past, depends the color of the tongue. So if the tongue is bright red, crimson red, it happened now, at the moment. If the tongue is pink, tongue's a bit paler, so it has been happened in the past. So this is slightly different. But based on this statement, indeficiency does correlate with this kind of specific tongue coating changes. Thank you very much. Number 14. Presence of the tongue coat indicates the stomach's qi, or help to predict progressions of illness. Thank you. So tongue coating is a very important signs to indicate it if you have stomach chi or not. If you see some very, very old people in a nursing home, they have no tongue coat at all, usually they are correlated with suffering of no appetite. Same for any age group. Once you have no tongue coating at all, your appetite usually are not strong. And once you have some level of tongue coating, or we call that once you have stomach chi, you have positive prognosis of any illness. Even this kind of tongue coating is very thick, greasy. It's better than non-tongue coating. Thinking about a natural environment, you go to the bush walking, you find a piece of the land, have very nice lushy grass, has not been mowing for a long, long time. You know, it's great, have get sufficient water supply, nutrients and sunshine. They just need to be looked after and to minimize possible snake hiding inside, causing harm for the humans. But if you're walking on top of desert, what that reminds you? It's death and nothing happening there, no more vitality, and even minimize the number of snake. So it's similar like a human body is there. Once you have very even thick and tongue coating, that means your mucous memory in the body is still functioning, but not functioning well. They're still functioning. But if there's no more tongue coating, your mucous memories in your digestion system and it gives up all their physical activities. They become stick. They cannot absorb any nutrients and they don't have any desire to show as a kind of appetite. Okay, this is also correct. So do not always blame your tongue coating. At least we have vitality of the life. If one day we can see our tongue coating disappear, if it's very old age, it's okay. If in very young age, you know something has had very serious damage. Now, number 15, severity of the Wenbing suffering are always correlated to the levels of body temperature from physical touch. There's very, very dangerous situations clinically. Some children have horrible, horrible high temperatures. Their lips so red, but when you touch their skin, they did not have corresponding high temperatures correlated. These usually happen in very severe, serious condition. So this is incorrect. For the very serious conditions, you could have very, very high, boiling hot internally, but it shows very, very cold in the surface and outside. These usually happen in very, very serious conditions for people does not have very good, healthy anti-pathogenic factors or in a very severe level of Wenbing sufferings. This is very dangerous. So physical touching is not very accurate way to indicate it how high the temperature is, how severe the Wenbing suffering. So this is a very primary one in traditionally to measure the temperatures. So nowadays have different form and to measure temperatures instead of just using physical touch. So they're doing blood tests, doing something else to checking that how severe the suffering is. Yes, you're right, Ri Zhang. So if you have a heat, sometimes your body's skin portal of the skin is not able to open properly. We call that anti-pathogenic qi so weak. You're not able to open your skin portal. You don't have any heat can present the surface. So surface still looks maybe normal, and internally if you're boiling. So it's very important at the moment you can monitor. The lips usually getting very, very red. Number 16, the upper gel disorders are, yes, Lucy?
Sorry to interrupt, just about that, what you were just talking about then with that correlation of body temperature from physical touch.
Yeah.
So in the case of, say, you know, people who tend to not get fevers when they get sick, does that sort of indicate that they could still be contracting a Wenbing?
That's excellent example. Wonderful.
Okay, cool.
Same. So many of us have very, very cold hands, yes. But we're still alive, do we? We're still alive, yes. So this is other extreme, yes, still similar one. So our temperature of the skin of physical touch does not always to equal presented our internal temperatures. So
for sure.
That's a very good example. Thank you very much, Lucy.
Thank you.
Thank you. Lip color is very more accurate in a way and to indicate the heat, because the lips is a kind of looks like exchange of mucous membranes in that specific part of tissues and bodies. Now, number 16, the upper gel disorders are always milder than the lower gel disorders in Wenbing. False, excellent. Because if the upper gel related with pericardium, which can leading to the death, can have more severe conditions than chronic ongoing disorder in the lower gel. So it really depends. So if something become absolute statement, usually it's very easy to leading to the incorrect answers. So we're all okay for this slide. We can go to the next slide, yes? Okay. Number 17. The disorder caused by heat pathogen usually is easier to resolve than illness due to the damp heat pathogenic attack. Now, what's the difference between heat and the damp heat? Heat is a simple pathogen, yes? And very quick penetrations, very, very young, either go or stay. No negotiations, no trouble. But this one is very sticky. It is cold in nature. They like to touch somebody. I love you. I'll stay with you for the rest of life. They don't want to go away. They like a horrible sticky glue. They just mingled with any kind of thing they can grab, either chi or yin or heat or damp or blood, anything. So once you have any kind of damp associated pathogens, it's always difficult to resolve. That's why once we have weak spleen chi, generally the damp, this kind of damp takes ages to resolve. Same for the Wenbing. Heat pathogen related disorder is much more easy to resolve than damp heat pathogen related disorder. So basically, this is correct answers. But if you use another example, okay, heat can causing death very quickly, and the damp heat not as quick as causing death, but it's a different one. Here we're talking which one's much more easy to resolving. If you're dead, it's already resolved naturally by the Lord. So either you already passed the 4 stages, your life's supposed to diminish. That's it. You don't need to resolve anymore. But left behind, mingled damp heat pathogens cause of disorder that takes ages to clean up. At the same time, they also damage your yin, constrain your qi, and causing a lot of disorders in the middle gel, in upper gel, and the lower gel. Now, any other questions for this one? Are we okay? Because we have mixed answers and false or choose. It's okay. No matter the answers we had, if we can get the common understanding for this concept, that'd be great. Number 18. Excuse me. 4 levels and sign gel identifications are only used for treating fever-related conditions or Wenbing clinically. So which is similar statement like previous one. Is it correct or incorrect? Please, we had similar answers. This is false. Thank you very much. Thank you very much. This is incorrect. They can use for other disorders like Zangfu organ disorder. You learn in internal medicine 1 and 2. So many formulas, and they come from Wenbing Classics 2 originally. So number 19, many autoimmune disorders or allergy disorders can be managed by applied Wenbing concept, and as well as their formulas. So this is a very important part, because if one day you are going specialist for skin disorders or any kind of autoimmune disease, you're going to do a lot of research. The correlated formula, a lot of them are related with classics too. And number 20, gently to vent the herb to out level and protect body fluid are primary principles in Wenbing treatment. This is very, very important. Thank you. Now, any other questions for these slides before we keep going? So we're okay. Thank you, everybody. Your participation makes me so happy. My heart is giggling. Now, 21. To deal with damp heat pathogen, besides clear the heat and transform dampness, qi moving and yin protecting herbs or methods should always be considered as well. So this also answered Lucy's previous questions. Is that correct? Yes, it's very essential. This is a fundamental concept, principle, idea, the principle of treatment. We should to keep that in our minds. Now, number 22. 针叶承气汤. Even we have not learned this formula, but we should be familiar about formula called 针叶汤 formula, as well as 承气汤. So this is basically modified of these two formula. 针叶承气汤 will be more suitable to dealing with constipation cases during the Wenbing suffering. Yes, so 针叶 means supply the body fluid. Yes, 承气 is to what? So using 大黄 dominated ingredients to purge excessive heat. So this is correct one. To dealing with constipation, also supply body fluid and yin. So 针叶承气汤. 承气汤, this formula we discussed in the formula study, and you also learned in Classics 1, also learned in Internal Med 1 and 2, I believe, in some different level. So this formula you have to be able to understand very, very well, because this is constructed from two original simple formula, 针叶汤 and 承气汤, and very easy to remember the composition as well. Now, number 23rd, person with a bright red tongue body, multiple tiny cracks without cold has less severe heat than person having a pink tongue body with multiple deep cracks. Okay, that's very good. So bright red tongue indicate we have a heat at the moment, currently, yes, with multiple cracks, tiny cracks. So something has been happened now. But once you have a deep cracks, pink tongue body, that means the heat happened in the past. So basically, this tells you heat is more severe at the moment. And that is just a residue of the heat resulting on healed, has not been healed of tissues left behind from previous heat damage. So this is what? Incorrect. Thank you. Number 24, the color of tongue can present various levels of heat internally. It's correct. That's why in the Wenbing, tongue differential diagnosis is very, very important. And in the future, if you're going to do telehealth, like naturopathy, homeopathy nowadays, they are going to start clinic practice and telehealth practice now. But for us, because we require post-diagnosis, require acupuncture practice, we cannot go through the telehealth to practice. But if one day and the epidemic situation is still similar like this, or you're more cautious or just for convenience, you can practice this specific tongue diagnosis during the telehealth consultation for your clients. This is very beneficial. Now, number 25. Bright red color in the tongue indicates excessive present heat, while pink, pale tongue with deep cracks for indicating past heat damage yin with possible current unresolved congested heat. So this answered the question for previous one. Yeah, this has answered explanation for previous one. Thank you very much. 26. Red tongue body is always the result of progressions from external heat pathogenic attack. It's false. Okay. Once they make it become absolute, so it's always something not right. You can have very, very red tongue after eating very chilly, spicy soup or dishes. Yes, you can have emotional congestion heat resulting in tongue getting red. And you have very bad gum infections and causing horrible red tongue without external attack. So this is incorrect. Thank you. Number 27, you can see through the color of the tongue body only in thin tongue coating cases. You can see through the color of the tongue body only in thin tongue coating cases. So what means thin? Thin means you can see through color of tongue body. This is correct. So some people say, oh, they have very thin tongue coating. When other people check it, oh, the tongue coating is not thin, it's quite thick because you cannot see through the color of the body. If there's no tongue coating, there's no coating at all. But once you have very thin tongue coating, that's a normal tongue coating, you still can see through color of tongue bodies. If there's no tongue coating, there's no tongue coating. The tongue basically becomes naked and present in front of you. If there's no tongue coating, whole tongue body is presented in front of you, nothing covered. If it's very thin tongue coating, it's normal tongue coating, yes. But if the tongue coat becomes greasy, and that is much more harder to see through, so that's more greasy one, or very, very dry. You can see through. Oh, okay, all right, you're right. If there's this one, it's okay. Okay, I try to focus on, that's okay. When I try to construct this sentence, I try to focus on the thin tongue coating is you can see through tongue coating. But you're right. If you're using the only here, which is incorrect, means if you have no tongue coating, you still can see the tongue bodies. You're right. This is incorrect based on this construction of the sentence. Thank you very much. If we have very thin tongue coating, we can see through the tongue bodies very easily. And if you have very greasy, thick yellow tongue coating, you cannot see through the tongue colors. But you can see the tongue body color through the regions does not have a tongue coating covered. Yeah, because around tongue edge, there's no tongue coatings covered. You can see the tongue color. Yes. Thanks, Nicholas. Technically, the statement is incorrect. Yeah, it is incorrect. Thank you very much. Thank you. Number 20. Number 28. The thick, greasy coat usually present all over the surface of the tongue body. So this is false. Usually they present it in where? It's mainly in central part and around the edge of the tongue body. Usually they don't have very thick tongue coat covered. Thank you. So this slide we have only one correct one. So addressing the sentence with different language presentations, they're going to have indicate different result. Next slide, 29. Flappy or swollen tongue inclines to generalize the qi deficiency, while a thin, smaller tongue body tends to the insufficiency. Thank you. So this basically is correct. Number 30. The macula of the skin in the skin is above the skin and the papillus is leveled to the skin. This is level to the skin, and this is above the skin. So we just need to swap these terms. Thank you very much. This. We need to swap this one, and then they become correct one. Now, 31. Receding and pale gum is a sign of the stomach heat in Wenbing. False. 32. Swollen and red gum indicates excessive heat in the kidney. False. So we only need to swap the associated what? These and this can become correct conditions in a way. So receding and paler tongue bodies usually relate to some kidney yin deficiency with the heat. Swollen red gum indicate excessive heat in the stomachs. So that is why we need to be able to monitor by checking the tongue bodies as well. But do not insist to check the gum and the teeth when you check the tongue, because we are not the dentist. Just naturally, if you find it, you see it. If you can't find it, that's it. Now, next slide, 33. Poor luster in the teeth associated to the poor status of the kidney yin. Okay, which organ corresponds to the health of the teeth? Kidney, good. So this is correct. So teeth is part of the bone, yes? So health of the bone corresponds to the kidney yin or kidney jing. Now, number 34. Miliaria alba is a kind of skin conditions. This looks like a little bit bubble. It's a mild skin rashes conditions when being, which is related to the trapped damp heat in the collateral. Yeah, this is a very popular or very common condition happen in the summer, very hot, and people not able to sweating out. So once they're walking on the sun, are suffering a lot of heat, and they feel hot, but not able to sweating out, they can see the skin have some bubble-like lipid rashes comes out, and they're very easy to be resolved spontaneously without any treatment. Or have very hot shower, go to spa, just a bit sweating, supportive sweating that can help resolve by itself. 35. Changes in the color, size, and the numbers of skin rashes, as well as their distributions on the bodies, reflect to progressions or prognosis of illness in certain human beings. So this is correct one. 36. Lurking pathogen can cause more severe disorders than non-lurking pathogens in one being. Yeah, this is correct in one being. So they're all correctly sliced. We're okay. So the last one. Number 37. Heat is yang, cold is yin. Heat pathogens penetrate quicker than the cold one. Therefore, one being progress much more faster than the Shanghai disorder in general. Okay, this is a part of comparison between Shanghai and one being. Is an important point for you to be able to understand it before prepare for the exam. 38. So do mark it. Now, 38, the common symptoms and signs of flu are similar to the windworms or spring worms in Wenbing. So the common symptoms. Even if a patient is suffering from vomiting, diarrhea, and fever post-flu virus infections, we can still interpret the relevant symptom signs under the category of the windworms or spring worms. The whole statement is twisted. From here, change the whole focusing. So what is this? This is damp heat or heat, wind heat or heat, vomiting, diarrhea, and fever. It's a damp heat. So damp heat is different than common windworms and spring worms pathogens, yes? So even they has been presented, has been happening after flu virus infections, once you present as kind of gastro conditions, they do not belong to windworms or spring worms anymore. Which category one being they belong to then? Damp worms, damp heat worms. So when you're selecting conditions in one of the categories for one being for your assignment, do be careful selecting relevant clinical manifestations. If you involve everything, all the possible clinical manifestations, you do need to spend quite some time to interpret properly, according to proper syndromes correlated with 7 categories in one being. So one being, 7 categories of one being, some clinical manifestations, and the flu or hepatitis name of disease is conventional medical disease diagnosis, based on the blood test, based on X-ray, based on specific pathogens, and proved from some tests. So these are two different perspectives. So do be careful when you interpret. So this is incorrect. First half of sentence statement is correct. Up to here, everything's become wrong. Because the common symptoms of flu symptoms is what? Cough. Yes, throat, high temperatures. That's why wingworms or springworms, it happen in the spring. But once you're suffering, instead of no more cough, instead you only have vomiting, diarrhea, and fever, they are not belongs to winged worms and springworms anymore. They become damp heat worms. Does this explanation helps understanding difference? Yep. Okay. Now, Livia.
I think you just answered it, Ying-Mei. I was just saying, can it start off with wind warmth or spring warmth and then develop or quickly go into damp warmth?
It's not very common for this kind of the transmissions in Wenbing, but it could happen, but not very common here. So here, that's why I mentioned about common symptoms. Common symptoms, all upper respiratory conditions. All the flu virus cause upper respiratory conditions, disorders, yes? But this one is, yeah.
Sorry, I'm looking at COVID, and from my understanding at the moment, it started off as wind warmth, but because of the climatic conditions in Wuhan, it then developed into the damp warmth. So I was getting a little bit muddled up with my research, that's all.
Okay, individual clinical motivation is different. So you need, if you're choosing wind warmth discussions for one of categories in Wenbing, you need collecting the relevant disease based on that group of clinical manifestations. If you discuss the Wenbing in wind warmth category, and do not selecting vomiting, diarrhea as a major clinical manifestations, because they have no correlationship between these two.
Okay, I'll have to think about that more. Thank you.
Yeah, for the COVID-19, there are so many different clinical manifestations.
Yes, that's
respiratory concern or disorder is the most common conditions around the world. But now they also find some kids, some adults, they don't have typical lung disorders. Instead, they have autoimmune disease response as skin rashes, or some others have very, very bad diarrhea, fever, and vomiting complaint.
Yes.
Yeah, not very common for them have both or three of them happen within one body. Does it make sense for you?
Yes, okay, so it has to be predominant.
You have to have clinical symptoms, yes. So
okay.
how do we define this? You have clinical symptoms to prove. So all the TCM based on clinical symptoms. Without symptoms, no name of TCM diagnosis at all.
Okay, all right, thank you.
Thank you. But this helped others to understanding how to choose proper clinical manifestation based on illness you select. And the same for the diabetics. We know the typical diabetic is what? It's hungry, big appetite, sweating, yes, want to eat a lot. But there are some people, they suffer diabetics, they don't have big appetite, they don't have lots of heat and sweating. Instead, they feel fatigue and depressed and put on lots of body weight even without eating much. And that not belongs to common symptoms of diabetic suffering. But based on the blood test, they are suffering diabetics. Does it make sense? So typical diabetic suffering, hungry, thirsty, and feel hot is typical what? Big four symptoms using 白虎汤 or 白虎人参汤, etc. But not all this kind of diabetic suffering are fitting into big four pattern. Some, they're only presented as a kind of progressive body weight gain resulting in depression and exhaustion, fatigue. And then they went to see the doctor, a blood test showed they're suffering diabetics. Does it help understanding the questions?
Yeah, it's a good analogy, thanks.
Okay, so it's very important. We have to be able understanding 34 to be able to select a proper topic for the assignment and to select the proper clinical manifestations. Same for the pneumonia. we know the typical pneumonia is the high temperatures, yes, cough, chest pain, and cough of rusty sputum, yes. But for old people, when suffering pneumonia, they have no high temperatures, they have no serious cough, they don't have rusty sputums from cough out. Instead, they show fatigue, no more appetite, only want sleep. Because they have different clinical manifestations, you cannot say they are not pneumonia. But when they have X-rays shows out, they are typical pneumonia, but present in old age due to poor anti-pathogenic factors. But in TCM, they are not fitting into the 麻杏石甘汤 pattern. For 麻杏石甘汤 pattern, 麻黄杏仁石膏 and 甘草, they have to have high temperatures, chest pain, cough out with rusty sputums. That's a typical pneumonia. Or other, maybe not a proper example. We know Asian people's skin is less white than Caucasians, yes? One day you find some Asian people, their skin is so good, like porcelains. It's incredible. Also have very, very pointing high bridge of the nose and big eyes, typical like Caucasians. But when they speak, they don't speak English or European language. They speak completely different old Asian languages. And they have no blood correlate with any kind of Caucasian background. Does it make sense? I'm not trying to be discriminated, but just tells us some untypical clinical manifestations still could correlate with same medical illness, but they could belong to different clinical categories in TCM. So TCM and differential diagnosis based on symptoms and signs. There's questions. Are you saying that COVID-19 and not great focusing for the assignment? It's excellent. Any kind of medical conditions could be used for assignment. You just need to be aware to understanding the 7 categories. So today we're going to introduce windworms. Do you need to understand what means windworms? Windworms is typical what? Quick onset illness, fever dominated, happened in the spring or winter. Could happen all year around in a very windy season. They do not have typical dominated dampness as dominant conditions. When the damp heat correlated, we do not use 4 level, and we use 3 gel differential diagnosis, and then belongs to what? Damp heat worms. They're not windworms anymore. Does that answer your question, Lucy? Thank you. So you're choosing one category from the 7 in Wenbing and correlate with Western illness and find the clinical manifestations. Only selecting a part can help you understanding and one of the categories. So selecting the major common symptoms. Do not select some symptoms very weird, very rare, not very commonly happen. Okay, come to the 39. The symptoms in any conventional illness are always related to one of the 7 categories in Wenbing. So in some way, 39 will help us understanding, consolidate understanding for 37. Because of this. Number 40, many hepatitis manifestations are related to damp worms in Wenbing because of their yellowing, diarrhea, nausea, vomiting, yes, and fevers or hot. Or applying Sanjo theories for differential diagnosis clinically. But if bleeding and fever are the main claim, and even suffering hepatitis at any stage, we can still apply 4-level differential diagnosis clinically. True or false? So when bleeding, fever become main complaint, what differential diagnosis theory we should apply? All levels. Thank you very much. So this means incorrect. First half sentence is correct, second half is incorrect. So when the bleeding and the fevers come through, no matter your hepatitis, others always apply 4 levels differential diagnosis in Wenbing or clinically. So when they have a damp warms, you're using what? Sanjiao differential diagnosis, yes, in Wenbing. But when you have fever and bleeding, that's typical what? The heat in blood level, you're using 4 level differential diagnosis. So do be careful when you're selecting and the common clinical manifestations for the Western conditions you use for assignment. And there's question, doesn't it make it a true statement or doesn't it? It is incorrect. The first half sentence is correct. Up to here is correct. After that, it's incorrect. Oh, okay, oh my God. So whole sentence is correct. Oh my God, I'm sorry. The whole sentence is correct. Oh my God, I'm going to clean it. It's so bad. So this is a correct statement. When they have damp warms, we're using Sanjiao differential diagnosis. When the bleeding and fever, we're using 4 level differential diagnosis. This is correct. Oh God, I'm a bit confused for myself. I'm sorry. Just checking to see if we are paying attention. I'm sorry. I lost my concentration due to insufficient. I'm sorry, a bit too much. Isn't too heavy. It's too much. Okay, thank you very much. Okay, we finished. Yeah, no more. Okay, that's all. So first 3 weeks are very important introduction. You have to really understand the basic concept. From week 4 onward, they are going to repeating some information we discussed from the first 3 weeks and through the individual category discussion. Thank you very much. Oh God, I think I'll fall asleep very easily in mind. And this exercise is a bit too heavy, so you can see my concentration span really shows its weakness. It's very, very bad. And I believe most of you are still very young, well focused. Thank you very much for your supporting. So without your supporting, I'm going to be misleading for my own mind. So what's today's concept? We know first category of Wenbing is what? Wingworms. So what is wingworms? I believe all of you had a chance to read of that, yes? So basically, I don't need to read it for you anymore. You already know that one. It's a wingworm pathogens attack in the spring or warm winter, causing typical wingworms. Actually, clinically, they can happen all year round in a very windy season. And so what is wingworms clinical manifestations? Any dampness involved here? Or just a heat in the wee level? So no damp, good. We don't need using Sanjiao identification, only using 4 levels, so it's in the wee level, very obviously. So these are disruptions of function in the wee. So that's why I have all these and explanations about why they have headaches, channel obstructions, and disruption in the lung functions, cough and wheezing, and damaged body fluid. So it's all result of wind heat in the surface, in the channel. Partially already goes a little bit of organ, not very severe yet. So once I become very productive and very, very productive yellow sputum, they'll go to much more deep level instead of channel, go to organs still in this kind of upper respiratory systems then. And these slides are sent to you through my class message this morning. Not very clear color because I use that color, it's so dark. So this basically flow chart can help you understand these basic conditions. I'll leave you for self-study. And it's very easy one to understanding based on your internal med knowledge, based on your previous formula study, clinical experience. It's very easy understanding. Just combine your foundation, diagnosis, pathology, and together to understand the concept. And these slides I sent to you as well this morning in my class message. So there's a comparison between wingworms and springworms. Because wingworms can happen in the spring. Springworms also happen in the spring. How do you know which one is which one? For wingworms, they has noticeable exterior symptoms, so more weak conditions dominated. But for springworms, weak conditions, very, very short. They can transmit into chi level very quickly, very, very short, and dominate with chi level heat. So that means because more severe heat, very high temperature goes through. So people could have present wingworms first few hours and then become wingworms so quickly. So it doesn't matter is it incorrect or wrong differential diagnosis. Once it belongs to wingworms in the spring, they all can be accepted because the treatment is exactly the same for early stage of formula. But no damp has been mentioned here, only heat and wind. And here's a basic interpretation about normal progression for wingworms. So always start in the V level, always start in the lung systems or Tai lung divisions. And once the problem cannot be resolved, they could possibly penetrate and transmit in the chi level, become big four. Or they could start in the channel of systems here and then affect to the middle gel, stomachs, as well as possible constipation in the large intestines. So this is similar, like Sanghan you discussed, from Taiyang and go to Yangming division, either Yangming Qi channel or Yangming Fu organs. Normal progressions, once the Wi channel has not been resolved, go to Qi level. Typical conditions in the channel of Yangming is big four. So high temperatures, big thirsty, and big pounding pulses and sweating. Yes, Livia? Yes, Livia?
No, I haven't asked anything. Sorry, not me.
Oh, you raised the hands.
Oh, sorry, that was an accident.
Okay. Thank you. Now, if the Yangming channel condition cannot be resolved, very easy, can transmit into large intestine Fu organs without constipation. Yes, Lucy?
Yingmei, sorry to go back a couple of slides to the differentiation between wind warmth and spring warmth. When you're looking at sort of looking at the exterior and then spring warmth being more internal heat syndrome, does that mean that spring warmth is more at the chi level compared to wind warmth, or is that different?
Spring warmth, yeah, the dominant with more chi level. That's why in the wind level, very, very short period, yeah, and then dominant with all the chi level conditions.
Okay, and then wind warmth is more.
Wind warmth have more noticeable wind level.
Okay.
But spring warmth does not have noticeable one. They can transmit in chi level very quickly.
Okay, thank you.
Yeah, and both of these two in the very early stage, wind level can very easily get confused.
Yeah.
Yeah.
Awesome. Thank you.
Once the Yangming channel's heat cannot be resolved, they can be present Yangming Fu level heat, which is constipation related, like Chen Xi Tang symptoms as well. So this part, we already know that from formula study, from Classics 1. So this is basic Bai Hu Tang syndromes. This is Chen Xi Tang syndrome. So Bai Hu Tang is going to discuss later in the following slides. But if they do not follow the normal or common progressions, so adverse progression could also happening. If the heat passing is so severe, and they could, without go through qi, they can go through yin and blood level straight away. It's not a very common one, but could happening in some level. Same. Instead, from the lung, go to large intestine. Here, from the lung, go to the pericardiums, and causing unconsciousness. And same here, if the lung heat has been very well and vented out level, they can trapped in the collaterals. So this is a good one. This is good. The last one is good progressions, and without any treatment, without any kind of the pay attentions and involvement, they just slowly from lung organs slowly evaporated out to trapped in lung channel, slowly resolve by itself. So usually happen in people have a good anti-pathogenic qi to resolve all these kind of virus infection, pathogenic infection by itself. But these first two are very, very poor physical constitution involved, and severity of the heat pathogens is more than body can coping. So this similar like we just described, adverse progressions. So either from the lung channel or lung organs, instead of go further, go to Yang-Ming channel, Yang-Ming organ. It goes transverse pericardium, resulting in emotional changes or sun disturbing, and some can become skin rashes. But if skin rashes just a little bubble-like, they can resolve by itself. But if it's bleeding without internal heat, they also can resolve by itself, like skin rashes. But if the bleeding also have internal heat correlated, this could be part of go to nutritive level. So this could be partially overlapped, go to nutritive level, as well as collateral obstructions. So it depends how severe about internal temperatures. The main diagnosis point. So what season of the illness has been happening? What are the major clinical manifestations, symptoms, and signs? What Western disease correlated, if it's possible. So this can help you understand possible prognosis and progressions. By checking up the windworm's principal treatment is very simple. Early stage what? Diaphoretic, make body sweating. Because the heat passion dominated, we need using cooling herbs, aromatic, to vent the heat out to the surface, let body sweating. When you go to mid stage in the Qi level, using Big 4 and clear the heat, also protect the yin. If it relates with blood or nutritive level, we need cool the blood and supply the yin, stop bleedings, and resolve possible heat trapped also into the pericardiums if the sun disturbance has been involved. If you do have a patient clinically presented pericardium has been affected, try some gentle acupuncture to waking up this kind of obstruction in the pericardium. At the same time, contact with hospitals to try to go to the emergency, because if they progress very quickly, and can be very dangerous for us to manage in the clinic. And later stage, we usually try to look after damaged yin of the body from heat pathogen attack, and also maintain good recovery of the lung and the stomach yin to make sure lungs still able to perform DD function, stomach still able to help to maintain good appetite, and also help supporting TT function in the lung or in the spleen. So windworms is very brief, very simple one, and nothing complicated. If you could thinking about yin qiao san, sang ju yin, basically they mimic that similar conditions with previous study. So have a look this kind of basic example of in wheel level attacked by the windworms. You're using yin qiao san because they have a chills, fever, sore throat involved. You can yin qiao san. If there's no sore throat, you can using what formula? In the wheel level of the windworms. If there's no sore throat involved, sang ju yin, excellent. So good. It's very, very obvious. So at least we remembered, we understand it. That's excellent one. Okay, here mentioned. So if it's cough is dominated with wind heat attack, using sang ju yin there. So sang ju yin is much more gentler wheel level wind heat attack conditions, and because sang ju yin itself and the composition herbs much more gentler overall. And the yin qiao san focus on more heaty, toxic heat, skin rashes, swollen gland involved. And if the cough becomes so severe with chest pain or difficult breathing, so early stage possible can develop into pneumonia conditions. And then we use Ma Xing Shi Gan Tang to help dissolve, clear the heat in the lung and the stomachs, and also descending and repelling the lung qi downwards to manage the wheezing. So this is very important. When you start wheezing, thirsty, irritabilities, profuse sweating, and very severe elevated temperatures. So the problems go to the qi level of the lung organ. We're using Ma Xing Shi Gan Tang to avoid further deteriorations. And this slide is also in your today's My Class message. There's a note. For cough and wheezing with predominant productive flame due to the lung heat, you can possibly add it 责备母瓜蒌全瓜蒌逐利车前子停利 to help resolve the damp heat in the lung, resolve the flame. If no dry stool, you can use 瓜蒌皮. If they have dry stool, using the whole 瓜蒌 fruit. If dry stool is so severe, so here mentioned using whole 瓜蒌 fruit or using 瓜蒌实, is the same thing. And for cough out with some blood strips, you can add it 白茅根、枸杞 and 仙鹤草. But if it's covalent lung abscesses, people had previous lung disorders, so some very bad smell odor discharges comes out, using 薏仁, the raw 薏仁, 冬瓜仁, 桃仁, 芦根 and 桔梗. So there's questions. How do you differentiate dry stool to constipation? Dry stool, you're still able to pass it out. Constipation is difficult, and you may skip one day or two, or just no flowing without specific help. So that means dry stool is a mild level of constipation. Constipation is more severe level of dry stool in a way. Thank you. For high fever, high temperatures due to toxic heat, using 银翘散 basically, or add an additional pair of 金银花 and 年翘 clear toxic heat with 蒲公英、紫花地丁、鱼腥草 the clear toxic heat and resolve bad odors from smells from the lung. It's good one for this one. So this just review of the herb. In a way, tells you you can have lots of possibility to do some modifications for the formula and present in the slides. Not necessarily follow exactly. Example like this one. If you cannot remember this formula, and like people have a heat, fevers, vexations, irritabilities, redness, insomnias, and slight yellow tongue coating, you're just choosing 银翘散. It still can work. Very good one. And maybe a bit more loose stool. But if you're only using 桑菊印, they're not strong enough because heat is much more severe than 桑菊印 conditions here. But if you know the guidance seeds is good to clear the heat from triple burner, and good to manage emotional disturbance related with irritabilities, anxiety, and these are very good combinations. So one is cleared heat, 三栀子 from bowel movement, 淡豆豉 cleared heat from the urination. So make the downward to exit to help clear the heat out. Are we okay? Okay. Now, next pattern is talking about the heat stagnations and with the flame associated with the chest and epigastric regions. So people have very red faces or flushed faces, fever, thirst, and only designed for cold drinks, may vomiting after drinking because body is too hot. Drinking cold liquid become natural rejections. Chest and epigastric regions feel very, very tense or distressed. Pain on pressures to the chest, epigastric regions may also have constipation, yellow, slippery tongue coat. Now, recommended formula here is 小线胸加紫石汤. So by checking the composition, they're using 黄连、瓜蒌、半夏 presented 小线胸汤, and additional 紫石 help regulate the qi in the upper and the middle jiao. Now, if you could not remember this formula clinically, what's important here is you can see upper jiao, middle jiao had obstructions correlate with constipation. If you could resolve constipations, usually upper jiao obstructions can get very beneficial relieved. So some way open the bowel, very essential to help withdraw the heat and flares up in upper middle jiao. So open the bowel at the same time regulate the qi, protect the yin will also help. So may just using 承气汤 or 针叶承气汤 or 宣白承气汤 to help if you could not remember this formula. But this formula is very, very good one for a lot of, not just for the condition in Wenbing, because of dominant ingredients of this, very good for lots of glaucoma related conditions. or a lot of hiatal hernia related, and chronic gastritis related, and glomus complaint with lipid congestion, flame involved, and qi obstructions after eating or after heavy meal. And there's comparisons between 小线胸加子时汤 and the 白虎汤 pattern. So these comparisons, when you have comparison for the exams or for the practice, you always find something common and something different. So here's a difference and commons put in different chart, different space. So they all have similar internal excessive heat symptoms. The different things is for the 小线胸汤, they have a flame heat mingled and causing obstruction in the chest and up epigastric regions, so feel bloated in below the sternum or on the chest. But the 白虎汤, they do not have that kind of bloating because they have very clear excessive heat only and resulting dehydration of the body, more thirsty dominated. So that's a big difference. They don't have obstructions and physically in the organs there, because 白虎汤 syndromes is more Yangming channels disorders, but this one involves some fu organs in the upper and middle jiao. And comparison 小线胸子时汤 pattern with 承气汤 pattern, they all have constipations, all possibly have constipations. But for the 承气汤 pattern, constipation is major conditions without other flame involved condition. They may still have qi obstructions, but they don't have a flame. And so heat, qi obstructions, and hardness of stool are very dominant. So everything's excessive for forceful pulses and very strong complaining hardness to push in the lower quadrant of the abdomen. But for 小线胸汤加子时汤 syndromes, they have more obstructions not in the lower quadrant of belly. They're more focusing in below the sternum. And the tongue coatings mixed greasy and slippery tongue coating, and because mingled flame and heat, so the pulses and instead of rapid also have slippery pulses there. They may affect in some level with eatings, so can feel more discomfort after meals. But for 承气汤, it's constantly feel discomfort, no matter you have food or no food. And blockage of the lung by the flame and the heat, coupled by clumping of the stool and heat in large intestines. So this 宣白承气汤. So 白 means a lung, means white lung. 宣 dealing with obstructions, disperse. 承气 we know is deal with constipations. So by checking the compositions, we know the 大黄 is present in the 承气汤. All the rest deal with excessive heat in the lung as well as flame in the lung. So here, cough with yellow sputums and dried. So if the cough with yellow sputum, we can think about the 麻杏石甘汤. But because they also have dried stool or possible constipation together with abdominal distensions, so we know they has coupling both. That have a flame heat in the lung, also have excessive heat and qi obstruction in the colon. So we need to induce this descending the qi downwards in the lung, also help to open the bowel. So 宣白承气汤 will be a very, very beneficial one. So 宣白承气汤, 针叶承气汤, these two 承气汤 are very, very commonly used in clinical practice for wound suffering. So if people have a pneumonia-like conditions, at the same time have very bad constipations, 宣白承气汤 could be possibly used instead of only 麻杏石甘汤. Any questions? You did not have these comparison slides. Okay, I'll send it to you. So I'm sorry, I saw this is, everybody have this one. Okay, now don't worry now, just try to understand this one, that'll be fine. I saw the exact same color, same image. It's all made by Bettina. I did not realize it was updated one. Okay, I'll send it to you very, very soon. Now this 沙生麦门冬汤, but the previous interpretation, is that understandable? Are they in the revision in the exercise slides? If in the revision exercise slides, you can utilize together. So just 1 more minute, I'll send it to you very soon. And this one, 沙生麦门冬汤. This formula we learned a long times ago from the internal medicine formula study. So I'll give you comparison later. But this one we know is basically focused on yin deficiency as dominated. Usually in the later stage, still have remaining residue of the heat has not been resolved. In both the lung and stomach channel or organ, represent as a major thirsty, dryness dominated. They may have dry stool, but thirst is more dominated. Dry lips, dry mouths, and they may still have a dry cough, but not as severe as very bad infections presented conditions. And then they're using 沙生麦门冬汤 to help to supply the yin, clear the residue of the heat. And 葛根黄芩黄连汤, this based on the composition. We learned it in the formula. You learn it also in the Sanghan Lun as well, Classics 1. By checking the composition, we know it's good for what? For unresolved external wind heat, and also partially this heat went to internally and caused possible diarrhea, loose stool. And you may ask, they have a damp heat, why we do not using Sanjiao differential diagnosis? Because the heat here is more dominant in level, or could be mixed together after you have this kind of 4-level differential diagnosis correlated wind warms, and then the condition changed. Like Olivia says, how about the condition changed? Condition changed. So this formula could use possibly in Sanjiao differential diagnosis. The issues is because we discussed possible transmission of conditions that presented here. So no matter it's a 4-level or Sanjiao differential diagnosis, all these one could present in a Qi level as well as in Sanjiao differential diagnosis. So here using 葛根黄芩黄连汤. But if people do not have horrible smells of stools, no diarrhea at all, this formula is not very commonly practiced in that situation's name. Next formula, 白虎汤. We know it's a big 4. It's easy. Heat from excessive in the channels or organ of stomachs causing big 4 conditions. 白虎汤. Which herb is missing here? 石膏知母知甘草 and which one is missing? Long grain rice. Excellent. So Jingmi is missing. So we should add it long grain rice into this one and forming proper classic 白虎汤. So 白虎汤 uses mineral products as a chief to manage the high temperatures, supported by 知母 to supply the yin, clear the heat, with additional 知甘草 and the 粳米 to look after yin and the chief perspective of middle gel or yangming. There's also comparison between 白虎汤, 白虎加人参汤, and the 生麦散. And this formula should be learned in the Classics 1 or has been some mentioned in the formula as well. So they all can be used for people suffering have big sweating or wheezing suffering. The different things is 白虎汤 and focus on big 4 and heat dominated with body yin and qi and leakage through the excessive heat. And 白虎加人参汤 focus more on the qi deficiency dominated with additional big 4. 生麦散 used your later stage, people have remaining heat, but with more yin and the qi diminished. So using different stage of the Wenbing and using different stage diabetic suffering nowadays. So it's very, very useful formula clinically. And this should be sent to you as well if they're not in your original slides. Clamping of the dry stool and the heat in the large intestines. So here mentioned the 调味承气汤. Have we learned this formula previously? in the formula sections in the classics one. Yes, learned many, many times. So these basically focus on they have weak spleens, qi, as well have constipations. They had constipation, have heat and dryness, but not much bloating. So that's why at the same time have some weakness in the qi. That's why using 甘草 or 炙甘草 help supporting weakened qi, and using 大黄芒硝 deal with obstruction heat, dryness present in the yang ming fu organs. So it's very good and gentle to help the bowel movement. And that's all for the first half of the session. We are going to have 15